Welcome everyone to the first of our webinars in our series around measures as part of Genetic Alliance's Registry Bootcamp. The bootcamp has from soup to nuts how to begin and maintain a registry for any condition, rare or common, or even community registries for environmental health, etc. I'm Sharon Terry, the President and CEO of Genetic Alliance. I will be recording this webinar so that it will be archived on our site. We will also have a PDF of the files of the presentation available there as well. Everyone is muted so that we can hear each other, hear the speaker clearly. If you have a question, we welcome you to put that in the chat box. And if you're not familiar with Zoom, which I can't imagine anybody isn't now in this pandemic sheltering time, you will find the chat bubble at the very bottom of the screen. And if you click that, you'll see the chat box and you'll be able to put any questions in there. If you're not muted, it means I can't mute you for some reason. And if you could please mute, that would be great. So without further ado, I'm going to introduce Carol Hamilton. Carol is a senior director at RTI in Research Computing Division. I've known Carol quite a long time. She's an expert in quite a number of important sciences, including biology, computer science, and computational biology. She's got training in genetics and biochemistry, molecular biology, etc. I've known her in the context of PhenX for some time, serving on the advisory board for PhenX, and really appreciate her expertise in measures and understanding how these can be used practically and at the same time retain a high level of standards for us. So without further ado, Carol, I'll turn it over to you.
Okay, sound check. Good?
Yes, very good.
Okay, so first of all, I want to thank Sharon Terry for the invitation, the opportunity to talk with you about the PhenX Toolkit. And it's especially exciting for me to present the work that this is a community-driven collective PhenX team. The work that we've done to support COVID-19 and also social determinants of health research. Okay, and I have the slides, right? Okay, all right. So here's the home page of the PhenX Toolkit, and you can see we currently are showing a couple of banners bringing attention to the COVID-19 protocols and also the just released Social Determinants of Health collections. Those were released on Monday. I think because these are both incredibly important topics and up there at the same time, but because COVID-19 is a little different, actually significantly different than anything PhenX has done before, I want to start off with social determinants of health, because then I can show you some of the features of the toolkit, and then switch gears to talk about what PhenX has done to contribute to the NIH response to COVID-19. So to start, I think I want to provide you with some background on PhenX and the PhenX Toolkit. And again, very importantly, I mean, this is community driven. There is there's overarching guidance provided by the PhenX Steering Committee. This has now been going on for since 2007. And I should say it's a cooperative agreement that's funded by the National Human Genome Research Institute, NHGRI, or Genome, with the project scientist is Aaron Ramos, who's just been terrific and to work with over all these years. The protocols are chosen by working groups following an established consensus-based process. So that's really where the content of the toolkit comes from. There is an outreach to the broader scientific community. And then where does all this work go? It goes into the PhenX Toolkit, which is a freely available web-based resource. And then we do as much as we can to get the word out, newsletters, presentations, and we've recently moved into a little bit into social media with Twitter and some YouTube tutorials. So why use standard measures? When we started in 2007, Genome was interested in this because genome-wide association studies were gaining traction, and people wanted to combine their studies to get higher statistical power. And when they got together and tried to do that, they found out that nobody had anything in common. And so the irony was that Genome recognized that they needed to do something to help standardize phenotypes in order to support genomic studies. What's happened over the years is as PhenX has gone way beyond genome-wide association studies in common complex diseases to clinical, translational, and certainly not just GWAS anymore. So here, but this is the genesis, you know, but for any type of study, if you have collected the data in the same way, then it's easier to compare, it's easier to combine. And then I think most importantly, there's a snowball effect where smaller studies can combine with other smaller studies, and it increases the impact of individual studies. And then just again, over time, you know, NIH perspective, the FAIR principles have become, you know, very highly recognized. The emphasis on reproducible results and increased expectations for data sharing. And so again, collecting the data in the same way helps with consistency, it helps with sharing, it helps with good science. So just to reduce confusion, people have gotten a good response that people really like this slide. What PhenX is and what it isn't. And it is a catalog. It is a catalog of recommended measurement protocols. It's a toolkit developed by the scientific community, and it's a web-based resource. It's freely available for use. I'd like to comment there, even a catalog of recommended measurement protocols, it's really much more than that. Beyond the protocol, the intent is really to provide investigators with all the information that they need to implement those protocols. Okay, what PhenX is not, it's not a new set of standards. It's not a new ontology of phenotypes and exposures. It's not a data repository, although we work closely with data repositories for obvious reasons. It's not restrictive. We hope that if there's a protocol in the toolkit and you don't like it, don't use it. There's lots of other options for you to choose from. And it's not, the toolkit itself is not proprietary. There's no cost to use. A little bit about terminology, because different terms mean different things to different people. So here, when I talk about a domain, it's a field of research. A collection is a little bit different than a domain, but they have some kind of shared characteristic. Measure is conceptual, but most important, and I think the biggest problem, often the biggest confusion, is the use of the word protocol. When I use protocol, I'm talking about the specific way that the data is collected, the measurement assessment, so it is not the study protocol. It is the nitty-gritty how you're collecting the data. A criteria. So this comes from the steering committee, and Sharon Terry mentioned that she is on that committee. And this is guidance for the working groups when they choose measurement protocols for the toolkit. Clearly defined, well established, and you can see the rest of the list. I think the really important thing here, and it's always a struggle for the working groups, is that the toolkit is about well-established measures. And the idea that that they should be relatively stable, it should be usable for 3 to 5 years. And sometimes the working groups, there's something that's really bleeding edge, that's really compelling, and they really wish they could do it, but it's not ready yet. Sometimes we put something like that. We have a section called supplemental information, and sometimes we can kind of inform the community. But I think it's a very important point for you all to realize. Okay, breadth of the toolkit. So PhenX is broad, and for lack of a better word, shallow. Each of these working groups, you can look at these are broad territories, cardiovascular, geriatrics, ocular, anthropometrics. Each of the working groups was allowed 15 measurement protocols, more or less. So the idea is that this is the common currency for people to come and, they're designing their study, and they come to the PhenX toolkit to choose some measurement protocols that will make it easier for them to share with others, to be collaborative. And so you have lots to choose from depending on what type of study you're designing. Features, and you'll get to see a few of these in a few minutes. So there's nice faceted browsing, there's some search capabilities. The key thing is you can take what you like and you can add it to your toolkit. You can save it, you can share it. And then anything that you do moving forward is custom. In the data dictionaries or data collection worksheet, it's all specific to the protocols that you put in your toolkit. Okay, so introducing social determinants of health. Hopefully that's in a PhenX background to get us rolling. This was just released on Monday. This was announced by the National Institute on Minority Health and Health Disparities. It was funded by NIMHD as well, as a supplement to the PhenX genomic resource. I want to call out the project scientists, Nishadi Rajapensky and Nancy Jones, who were absolutely terrific. I'll get to the working group in a minute. But 19 new measurement protocols were released. And what's very interesting about the way this one was done is that there's a core collection, which is going to be recommended, as I understand it, for anyone doing research in the social determinants of health area. And then there are 2 specialty collections that are organized by individual or structural. Here's the working group. So these are the guys who really did all the work. I want to call out the chairs, Barbara Entwistle and Alicia Fernandez. And also Aaron Ramos, again, the project scientist for PhenX. But for each working group, there's generally a liaison from the steering committee, and Aaron was the liaison for this particular working group. So here's the core, and you can see the core collection. They're typically, we have done this for other projects, they're a combination of existing toolkit measures and newly selected toolkit measures. And so you can see the ones delightfully highlighted in yellow were chosen by the Social Determinants of Health Working Group. But you can see that there was a significant amount of content already in the toolkit that they thought was important enough to include in this core collection. The specialty collection individual, here, this is almost all new content, and you can see the range of protocols that were included that are, and as we have, you saw the research domains, and as PhenX still engages additional working groups, it's really important for the working group to build on the existing content, and I think this working group just did a great job. And then these are structural, so these are more at the community level. Food swamp, social vulnerability, really interesting. I think just incredibly important additions to the PhenX toolkit. Oops. So here, so now I'm taking you actually into the toolkit. Screenshots are sometimes not the best way to show content, but here again, there's the banner. If you click on the banner, that will take you to the collections. If you click on the button in the bottom right-hand corner, that will also take you into the collections. And so here's how it looks. You'll land, and you can see there's information about the project, the scope of the project, the roster of the working group, and then the core and the specialty collections. And you can see that you have the opportunity, even at this level, if you want to add the whole core collection to your toolkit, you can. If you want to look a little closer, you can open that core collection, and here you can see the measures that are in the core collection. Again, now at this level, you can add each protocol individually to your toolkit. If you want to, here's search. So here's community, and the main thing here is to show you that if you do a search, you also have these filters that you can see below by data collection mode, life stage, so on. And if you get a return from your search, this is using community as that keyword, you can see that you also get those filters that show up on the left-hand side. So you can toggle on and off. You can choose the type of measure, click it on, click it off, and your search results will change as you do that. And if you want to see additional detail, then here's actually looking at the protocol community risk and protective factors. So this was going from this first one at the top of the search list. And clicking on it. And then you can see you get a description of the protocol, you get specific instructions, and then you can see there's additional tabs. I'm not going to walk you through all of them. There's additional information about the protocol. And on the left, also, you can see related protocols that the working group says, well, you know, you're interested in this one, you might want to take a look at these as well. Once you have selected a number of measurement protocols and you're happy with your toolkit, you can choose to download a number of different types of documents. People have really expressed deep appreciation for us providing data dictionaries at the click of a button, literally. Data collection worksheets are intended to help you merge whatever you've done in the toolkit into your existing study protocol. Oops, oh, we did that again. Sorry, so a couple more, just a couple of other features that I'd like to show off. So you can see, so research domains, and you saw the breadth of the research domains, and you can browse through the domains. But I also want to show what we have in the toolkit for looking at research using PhenX, and then the browse protocol tree, which gives you a kind of a cross-domain view of the toolkit. And so this is research using PhenX, and we do this a couple of ways. Investigators who are using PhenX measures sometimes submit what they've done to us, but we also mine the publications, the research that cites the PhenX toolkit. And so you can go in here and you can look and you can see the studies that have used PhenX measures. And then you can sort, actually look at specific protocols, and you can see how many studies have used a particular protocol. So this is just kind of cool. And it also shows use in the community. It might influence you if you are looking for collaborators, that sort of. Then here's the concept tree browser. And so you can see that the categories are a little different from the domains, diseases, chemicals, and drugs, and so on. And you can see it open up anthropology, education, human activities, and so on and so forth. And to illustrate a little better, oh, and I should point out that these are based on MESH. This is medical subject heading. So when we find it imperfect, we remind ourselves that it is based on a very widely used medical vocabulary. So here's kind of how it looks, or illustration. You can see from musculoskeletal diseases. So grip strength, that came from the physical activity and physical fitness working group. Pain came from skin, bone, muscle, and joint, and so on. And so you of course won't see those domains when you're looking in the tree, but it's just a different way, it's just a different perspective to help people look at toolkit content. And then one more nice kind of illustration you can see here for cystic fibrosis. You can get to cystic fibrosis through digestive system diseases, if you work down through that hierarchy. You can also get to it from respiratory tract diseases. So this is a nice, you know, people come at what they're interested in from different perspectives, and that allows you to find things different ways. And here you can see then if you click on for cystic fibrosis, the sweat chloride test, it shows you the protocol. Okay, and then there's a few other things, because sometimes I'll give a presentation and they say, well, you know, what have you published, or what about this, what about that? And it's like, there's actually quite a lot of resources associated with the toolkit. Hopefully they're reasonably easy to find. If you look in the resources tab, and this is right on the home page in the navigation bar, we do have publications and presentations, and there's some other, there's another way to get into research using PhenX. News, we do put out newsletters occasionally. We do have all the funding opportunity announcements presented, and some use statistics and help. So here we do have a couple of tutorials. We're working on some more, and you can also see across the nav bar we have our new little icons for Twitter and tutorials, YouTube as well. That's enough of that. Okay, so here we go with COVID-19. You know, everybody knows this is absolutely unprecedented. This is from the from NHGRI, from Genome's homepage, and NIH ramps up research on COVID-19. So what's happened here is that I should go back. What's happened is that Bill Riley, who's the director of OBSSR, oh, I can't remember what that one stands for, came to Aaron Ramos and was looking for a quick response for COVID-19. And Aaron came to us, and so we tried to put together a plan pretty rapidly. And then I sent a note out to the steering committee for PhenX and said, hey, what do you think about this? And off we went, because PhenX is organized as a cooperative agreement, we have that flexibility, which was terrific. So the point was, what Bill Riley's team was seeing was that that there were many groups very interested in a rapid response to COVID-19, trying to collect data to figure out what was happening, right? The problem is that everybody is doing it and sort of scrambling. And so the idea was, if we could create a resource where we could post some of the major protocols. So the first ones we started with were like World Health Organization and Centers for Disease Control, CDC. And so we thought, well, maybe there will only be a dozen or so of these things, and people can go to this page and they can look and see what's out there, and they can choose something that will work for their study. So we didn't really know what to expect, but it's turned out there's actually quite a lot of protocols. So we have a little bit different problem than we had anticipated. So you'll see this more in a minute, but in the near term, we're going to develop some simple tools just to sort and browse and look at protocols on that page. And we're also coordinating with the Public Health Emergency and Disaster Research Response, DR2, which will be a protocol repository. So this is a cross-NIH collaboration for sure. And yeah, OBSSR, NIEHS is actually heavily involved with the DR2 website. NIAID, of course, that's allergy and immune diseases, infectious diseases. Anyway, the other thing that we did, because what the PhenX team did was we got all these different instruments from OBSSR. And what OBSSR would do is they would look at, the OBSSR team would do, is they would look at what the instruments were. Some went to DR2 because they were really more disaster resource than really suitable for PhenX. But many of them did come to PhenX, but they were carved out in modules and with recommendations to carve them out so that people could take pieces of these protocols, not necessarily have to use some of them are quite lengthy. And so in order to help people look at those modules, the PhenX team tried to come up with kind of main topics so that we were reading through every single protocol. We didn't want other people to have to do that. And we've shared those designations with DR2. So what's been happening? So the first release was on April 8th. The sixth one was yesterday. 55 full questionnaires, 212 modules. 62 main topics. We do a release every Thursday. We shut the door at close of business on Monday so that we can do the work to get them out the door on Thursday. So how does it look right now? You can see we do post the entire instrument for context. And then if you open up, you can see the main topics. So you can see how we've characterized this group here: symptoms, status, healthcare, labor market. There's a wide range, economic insecurity, and so on and so forth. Okay, and this was a little bit dated now through May 5th. We'd had 8,000 visitors already, 8,000 visits, 7,000 users. We are tracking how many times each PDF is opened to see use. And at least it's a little bit confounded because, of course, the ones that went in earlier have been up longer. But we continue to track this as a potential way to kind of stratify the protocols that we've received. So now the real challenge is, how do we dovetail this COVID-19 work with the expectations that PhenX provides well-established, broadly validated protocols, right? This is a very, very different problem. And we talked with the steering committee about this just on Monday, and everyone agrees, the idea is to develop a COVID core and specialty collections is spot on. The trick is how to do it very rapidly. And what was recommended, and I actually think this will work, is we're going to crowdsource this. We're going to have to design it very carefully, but see what those specialty collections should be, and what measurement protocols should be included in the core and the specialty collections. And that way we plan to reach out to the protocol contributors and to a variety of listservs. A number of people piped up, including Sharon, as to helping get this out into the community and getting input. And of course, we'll also use social media. The steering committee, to keep this very nimble, is going to provide oversight. And so we think we can probably pull this together quite rapidly. So the message here is stay tuned. You'll be hearing from us, and we very much want your feedback on these protocols. So then, just to finish up, some use statistics for the toolkit. We keep gaining number of registered users. I would encourage you to become a registered user. It does give you some perks. You can see a few different things. You can save multiple toolkits, that sort of thing. We have had a significant number of visits. We do track in USA and also international. We do have quite a bit of international use. And since we started creating REDCap data dictionaries, we've had pretty good uptake by the REDCap community. So that's 388 PhenX protocols have been pulled into REDCap studies. And I think this is going to be really important for COVID-19. In the community, so NIH notices funding opportunities. This is what's amazing. So to date, 367. This means that the different institutes and centers across the NIH are recommending use of PhenX measurement protocols in their RFAs, publications, presentations. Top domains. So we're doing this in sort of aliquot so that we can see change over time, and you can see what it was for January through March of this year. And that's domains. And this is protocols. And then I just wanted to put this in. I'm not talking a lot about the bioinformatics underpinnings of the toolkit, but I do want to make a statement that we try very hard not to operate in a vacuum, and we do collaborate. We collaborate on CDEs, we collaborate on standards with data repositories and ontologies. So we do all those things. And this is another thing that we get asked fairly often, and that's about sustainability. The PhenX Toolkit is now quite well established. It has been funded since 2007, again with Aaron Ramos as the project scientist from NHGRI. But we've had lots of support now from across NIH. And so you can see NIDA, OBSSR, oh good, Office of Behavioral and Social Sciences Research, there it is. And this, I think this is really important, and I think Genome sees this, and I think the research community sees this as really broad support for this effort and the importance of standard measures in the research community. Yeah, okay, and then last but not least, this is a huge effort. NHGRI, the PhenX Steering Committee, which has we have members who started in 2007 who are still on the committee, working group chairs and working group members. This is hundreds of scientists. I haven't counted it up for a while. IC liaisons, so we have IC liaisons from most of the institutes and centers of the NIH who are invited to participate, particularly on steering committee meetings, but also they sometimes join in on specific working groups of interest. Project scientists from, I didn't talk about all these additional supplements that have kind of a deep dive in specific areas. And the RTI team, which, just continues to amaze me with the work that they that they produce and how much they care about what they do.
Great, thank you very much, Carol. Fabulous run through of both PhenX and the various tools that are recently released. We have time for some questions. If you have questions, please put them in the chat box. We do have one question so far, Carol, and I think this was when you were talking about the COVID measures, so you may have to go back to one of those slides. The question was, why does one category have the modifier of negative, but the other ones don't? So I'm not sure what slide that was from.
Let's see if I can answer that.
Yeah. And Kimberly, if you want to unmute yourself, you can, and maybe give a little more specificity. I think it was a little farther on.
Oh, negative social and behavioral impacts, is that it?
Yeah,
Yes,
Kimberly.
that's exactly what I was asking about.
Okay.
So, that's what the module was called. And so we keyworded it a little differently. So labor market economic insecurity. So that tells me that we translated it into negative social, being people being afraid of losing their jobs, people being laid off, people being part-time. So that's the negative social and behavioral impact. When you go, again, these main topics were just us trying to give a window into what the module has. But when you click on the protocol, when you click on that module, you can look at all the details. But it looks like that's how we translated it.
Okay, other questions? There was one earlier, Carol, about aligning, for example, with HPO, and you did have the slide with some of the ontologies and nomenclatures. You might want to say a word about the challenge of such an effort.
Yeah, but we do now. So HPO, it's very interesting, and HPO is more or less focused on things that have gone wrong, and disorders, diseases. And PhenX has more of a range of normal. It's kind of agnostic. You assess the phenotype, and the person could be healthy or they could be not healthy. But we do routinely now, as part of the bioinformatics pipeline, when new measurement protocols are loaded into the toolkit, we do actually link to HPO terms. And if there aren't HPO terms available, we suggest creation of new ones.
And for those who aren't maybe in that world, that's the human phenotype ontology.
So sorry, yeah.
Yeah, no worries. Any other questions? So the question about when the webinar will be posted, all of our webinars are posted on Genetic Alliance's website. You'll all receive a link to it because you registered, and it's easily navigable from our front page usually. Let's see. Somebody is just thanking you, Carol, that this is a tremendous resource. And when Bill Riley sent us the overall resource from NLM ? With PhenX being just one component, it was the only useful and easy one to navigate.
Well, I'm glad somebody found it easy to navigate. We never, when we started this, and I don't know, World Health Organization and CDC, and we thought, okay. And then the next week there were like 30, and Erin Ramos and I were talking about it. She says, well, I think, that's going to be about it. And I said, I'm worried. And because I knew ECHO is a longitudinal study of children and environmental exposures, and I also work on that project, and I knew they had 5 coming down the pike. So, but I think we can still help here. It's just going to look a little different than what we anticipated. And this is part of, I've got to give Bill Riley, really applause for really orchestrating this and getting this rolling. And I mean, this is just part of the NIH response to COVID-19, and we're really happy to be able to contribute, and the team is too. I could not believe how, just incredibly willing my team was to handle this work and to try to help.
Any other questions? All right, so I'll say a couple things. One is I've been really thrilled to work with Carol and the team all these years. I've seen this grow enormously in that time. At first starting out on the steering committee thinking I would have little to offer, but because Genetic Alliance uses measures quite a lot, I found that it really is wonderful to be in on these conversations, and in fact have been part of a work group and saw the enormous amount of work that a group does. So really a lot of applause to you, Carol, and to the team. Really fabulous, fabulous work.
Thank you. Thank you very much. I guess I went too fast, huh?
Yeah, no, it's fine. And then I'll say just a couple of other things. I'm going to stop sharing Carol's screen and take over the sharing. So Genetic Alliance, in fact, we also put a measure in the PhenX library of a catalog of measures. We have you know, our own registry system, which I should say has most of the PhenX measures in it as part of the library there, where you essentially can drag and drop to build your own registry questionnaire using those tools. And we also have a COVID survey, and we welcome anybody taking it, not just people who have had COVID. We have a partnership with XCures and with Luna DNA for this. The URL, as you can see on the screen, is fighttoendcovid.com. So happy to have everybody join us as you will or as you wish. Okay, nothing further. Okay, one more question. How, Carol, would you recommend that we encourage the new development of COVID research to use tools from the PhenX toolkit so that we are not generating even more potential tools?
Yeah, that was the goal, and I think some of this is really more NIH than it is PhenX, and I know Bill Riley has and Aaron and then also the people associated with the DR2 website have talked about how to promote this, basically to get the message out that this exists, so that people will go there rather than just create something from scratch. I think the you know, ironically, the crowdsourcing to help create collections that will be, you know, even better, will be, I think, a really good filter to have impressed on what's there currently. I think that's gonna help. And there's discussion about putting that on different NIH websites to promote that outreach. And again, you know, Genetic Alliance, and there were a couple of other suggestions. I think it'll go out to research networks. So not only will it raise awareness, but I'm hoping it will provide that filter, and we can create those core and specialty collections, and then we can really recommend them with some confidence.
Great. One thing that we're doing too, I'm sharing my screen again, Genetic Alliance has created a way for communities of any kind, disease, professional societies, clinics, soccer teams, whatever, to actually brand that screen that I showed you a few minutes ago with your own logo and use these tools so that you're using something that at least is in the library. We're making this at this time free. So essentially we have a very simple form that one would fill out as a community to create a custom landing page, and then go right into being able to use these surveys, as I said, with churches, temples, sports teams, whatever, believing that we really need to put the research in people's hands so that we're actually getting good data and getting it in a standardized way. All right, I think that might be it. Okay, well, thank you everybody for participating. We recognize the challenge that everybody's going through to different degrees, and appreciate that the kind of attention we can give and the way we can show up in the world around something like COVID is really critical. I'm especially pleased that the research community seems to be collaborating more than ever, and I certainly hope that we can translate this into collaboration for all biomedical research, because this certainly is all interrelated and not just this one crisis, but it's essentially, I think we've now seen we're a global family and that our health and disease are interrelated. All right, thank you, Carol. Thanks, everybody.
Well, there's one last question if I can take it.
Sure, yes, yes. Oh,
Because
yes.
it's the heart of the matter, actually.
Yeah, good.
So that is exactly the problem. And so, what we've done is we've carved out into these main topics, really annotations, so that we can see sort of high level overlap. But in fact, what we're doing, or what we started doing initially, was we created data dictionaries so that we could go to the variable level. And the plan is we're going to pilot a variable compare tool. But we didn't expect to end up with something like 200 modules. So we can't, that's a lot of work for data dictionaries. On the other hand, some of these have data dictionaries that already exist, and we can go out and look for those. So I think what we're going to do is we're probably going to take the first 30, we're going to pilot a variable compare tool that would show what it can do. Hopefully the crowdsourcing will help stratify, and even those that, the ones that go into the collections, okay, that's the cream of the crop, but there might be another rung that we would also create data dictionaries for, so that you could use the variable compare tool. And then down the line, of course, the frightening part about this is that the people who aren't using exactly the same protocol are going to need to harmonize their data, and that variable compare tool will help with that. So we kind of can't, it's kind of chicken and the egg. We can't do everything fast enough, but that's an excellent question. That's exactly, we look across and we read every one of those protocols, and yeah, there's some redundancy, of course.
Okay, I think that's it. Feel free to email Carol, and if you can't find her directly, I'll help you, or email me if you have any questions about anything from today's webinar. Again, this will be posted on the Genetic Alliance website under our bootcamp webinar series on measures. Thanks very much, Carol, and thanks to the team.
Thank you. Thanks very much for having me.
Bye-bye.
Bye-bye.